Hi, I'm Dr. Suzanne Kaseta, and you're about to view a short video about your baby from the doctors here at Washingtonville Pediatrics. Let's start with a look at how your 6-month-old is developing from our friends at Simply Parenting.
Six-month-olds are very social. They love to interact with everyone and will smile easily at funny faces and noises. They are beginning to play and will make their own sounds to get attention. Babies at this age will begin to express their likes and dislikes. They may stretch their arms out to be held and will fuss when a toy is removed or falls out of view. This is also the age when your child may develop separation anxiety and fear of strangers. This is a healthy development. Babies at this age are learning that they are separate beings from their parents and therefore that they can be separated. Your 6-month-old may understand his or her own name and may even react when you say no. Your baby's also probably getting better at babbling. Expect strings of one-syllable nonsense words and an occasional 2-syllable bit of baby slang. You'll have fun trying to interpret the sounds you hear most often. By 6 months of age, your curious baby will be able to reach for objects and transfer them from one hand to the other. Often the object is then placed in the mouth for further exploration. An important point to remember is that 6-month-olds put everything in their mouths. And those little fingers and hands can now pick up very tiny pieces using their hand as a rake or by grasping with the thumb and forefinger. It's time to be extra careful about what might be within your baby's reach. One object you shouldn't worry about in this capacity is the baby's bottle. Many babies this age can hold a bottle themselves. Some can even handle a sippy cup. In any case, mealtime should be much easier since by 6 months most babies can sit up in a high chair. On the floor, a baby will begin to sit unassisted, first in the tripod position and then fully sitting by 8 months. Babies at 6 months should be able to stand holding onto your hands as their legs practice pushing up from the table or floor. A few babies may begin to crawl at this age, but most are just trying to figure out how to move. But just remember, your baby is getting ready to explore the world.
Your baby will still need to breastfeed several times a day, or have about 24 to 32 ounces of formula a day. But your growing baby needs more than just the nutrients from breast milk or formula. So if you have not already done so, it's time to begin solid feedings. Use iron-fortified cereals, thinly mixed with breast milk or formula. Use rice cereal, unless your baby seems to be constipated, then use oatmeal. Wait until they are well established on cereal for 1 month before adding other foods. If your baby has been feeding for 2 months and doing well, they can now have 3 meals a day with a combination of cereal, fruits, and vegetables. They should have cereal twice a day, especially if they are exclusively breastfed. It's best to wait until 9 months to add more challenging table and finger foods. One thing we don't recommend is giving juice, which has a lot of unnecessary sugar, to babies. Introduce a cup of water, formula, or breast milk now to begin practicing using a cup. Infants should still be placed to sleep on their backs, but don't be surprised if they roll over by themselves. With good head and neck control, babies are at less risk for sudden infant death syndrome, provided they are sleeping on a firm mattress. Don't place toys, pillows, or blankets in the crib. Drop the mattress down to its lowest height and remove any large toys that your baby could use to step on and fall out of the crib. At this age, your baby should be sleeping 12 hours a night and having 2 regular naps a day. Ask your pediatrician if you are having any sleep problems. Nighttime sleep training is very important as you begin the second half of the first year. All babies begin to have night awakenings, and they will need to duplicate the conditions that help them get to sleep in the first place. Teaching your baby to fall asleep on his or her own using self-soothing techniques instead of feeding and rocking will pay off, as your infant can quickly put him or herself back to sleep in the middle of the night. Try not to run in for the earliest whimper. Give your baby a chance to settle down without your help. Now let's review some safety tips with our friends from Simply Parenting.
Follow these tips to keep your baby safe and sound. Keep small objects, pills, and toxic plants out of your baby's reach. 6-month-olds can pick things up with their fingers and will put everything in their mouths. This makes them a high risk for choking and poisoning. Never leave your baby unattended on an elevated surface. Now that your baby is mobile, he or she can easily roll off a bed or a changing table. Keep one hand on your baby at all times. Or if your baby is very active, try changing diapers on the floor. Bottom line, be strict about safety. Your baby depends on you.
Hi, my name is Debbie, and I'm one of the nurses here at Washingtonville Pediatrics. Here's some advice from our nursing staff. Now it's time to take care of those first little teeth. Gently wipe the teeth clean with a washcloth or very soft toothbrush after the last feeding. Toothpaste is not necessary at this time. And remember, never give your baby a bottle to take to bed. This is a major cause of baby bottle cavities. Here are some reasons why you should call the office if you're worried about your baby. If your baby has a fever with a temperature of 102 or greater, or has a temperature of 101 or greater persisting more than 24 hours, if your baby is more irritable than normal, if your baby is not waking to feed or is refusing to feed, if your baby has vomited more than once, or has a severe cough, wheezing, or is breathing faster than normal. Please feel free to call. We're here to help in any way that we can.
Let's end with a look at having fun with your 6-month-old.
Six-month-olds are really fun to play with. They are much more responsive to everyone and increasingly aware of their surroundings. As a parent, you will clearly see your baby's own satisfaction as he or she develops new language and fine motor skills. You've likely been talking and singing to your baby since he or she was born. Now, to help your baby learn to talk, you can also begin reading. Start with simple board books and nursery rhymes. Shakespeare comes later, although babies do love the rhythmic sound of poetry. You can also begin to name objects and people for your baby. Point out mommy, daddy, bottle, diaper, doorbell, and other common sights and sounds. Then do it again and again. This repetition will help your baby learn language fundamentals and eventually real words. Babies this age love to explore, so give your baby plenty of soft toys to play with, especially ones that react to a child's touch. Squeaky stuffed animals, rattles, and activity centers with knobs and buttons are usually a big hit. Use an overhead hanging bar to suspend toys that the baby can easily grasp and manipulate. And if traditional toys are too routine, one household item is sure to hold your baby's attention: a mirror. Babies can be fascinated by their own images for long periods of time. Let your baby touch hand to hand, nose to nose, and toe to toe. Let him or her see you in the mirror too. You're sure to get a smile.
Thanks for watching. We'll see you again when your baby is 9 months old.